nurses, today we're talking about toxicity. And now, what is toxicity, you ask? It is when levels of the drug in our bloodstream become poisonous, and it can make us really sick. So can you tell us a little bit, Sarah, about what kind of interactions we should be concerned about?
Well, thank you, Dan. Actually, I can. In fact, if you combine grapefruit with certain medications, it will actually have a toxic effect because the drug can't be broken down, and it'll stay in your bloodstream for a really long time.
Wow, I didn't know that.
Well, Sarah, what about things like caffeine? Does that have an effect?
Well, yes, actually caffeine does have an effect. In fact, if you combine caffeine with asthma medications, it will cause you to get the shakes, and your body will start shaking, and it overstimulates everything.
Wow, that's crazy.
It's good to know. So, Allie, what else can you tell us about drug interactions?
I can tell you guys, yes, about some drug interactions. It occurs when two or more drugs react with each other. Since nearly 40% of the population does have 4 or more prescriptions, it's really important to know how the drugs interact with your system. Specifically because many medications do become toxic. Toxicity can occur when similar medications that treat the same symptoms or conditions taken together create a dose that your body just can't handle. A good example of that is Tylenol and mixing it with a pain medication like Loratab. It takes the acetaminophen, the pain medication,
Makes it toxic, right?
makes it toxic.
Okay.
Okay.
What kind of symptoms would we expect to see with toxicity?
Well, the most common symptoms would be things like skin rash, hives, itching, fever, or shortness of breath.
And then you have a more serious reaction, which is called anaphylactic shock, which is usually when you have dizziness, lightheadedness, loss of consciousness, if you experience nausea and vomiting, severe drop in blood pressure. These are all things you want to go to an emergency room for, because they will result in death. Also, we want people to be careful that a drug reaction doesn't always happen from a new drug. Sometimes it can be an old drug that you've been taking.
Okay, so we as nurses, we need to just educate all of our patients. We need to know what kind of drugs they're taking and what kind of effect those drugs can have on each other. So we need to be educated, and we need to educate our patients. So we have some references and some resources here. All of these websites right here, you can find more information on all the topics we discussed today on the nurses. Join us next time.
Bye!
Bye!
I can't see her.